Hi everyone, welcome back to the channel. Today we're diving into an essential topic in dentistry: how to administer local anesthesia. In this video we'll focus on the maxilla, or upper jaw, and cover the techniques, landmarks, and tips to ensure effective anesthesia. Whether you're a dental professional or a student, this is your complete guide. Let's get started. To effectively administer anesthesia, we need to understand the anatomy of the maxilla. The maxilla has a porous bone structure which allows anesthetic to diffuse easily. This is why infiltration anesthesia is commonly effective. However, for larger areas or specific regions, nerve blocks might be required. Let's break down the key techniques for administering anesthesia in the maxilla. Let's start with the most common method, infiltration anesthesia. Where to inject? Near the apex of the tooth you're working on. Landmark: find the mucobuccal fold above the root of the tooth. Example: for a maxillary canine, insert the needle at the height of the mucobuccal fold above the apex of the canine. The purpose of the posterior superior alveolar, or PSA nerve block, is to anesthetize the maxillary molars, except for the mesiobuccal root of the first molar. You should inject posterior and superior to the maxillary tuberosity. The landmark to look for is the height of the mucobuccal fold, distal to the second molar. This block is particularly useful for working on multiple molars at once. The middle superior alveolar, or MSA nerve block, targets the maxillary premolars and the mesiobuccal root of the first molar when present. The injection site is above the apex of the second premolar. The landmark here is the mucobuccal fold over the premolar. The purpose of the anterior superior alveolar, or ASA nerve block, is to anesthetize the maxillary incisors canines and their soft tissues. You should inject over the apex of the canine or via the infraorbital foramen. The landmark to look for is the height of the mucobuccal fold near the first premolar. For procedures involving the palatal tissues, we use these two nerve blocks. The purpose of the greater palatine nerve block is to anesthetize the posterior hard palate and soft tissues up to the first premolar. To achieve this, you should inject near the greater palatine foramen. The key landmark to look for is the palate near the second or third molar, about 1 centimeter medial to the gingival margin. The purpose of the nasopalatine nerve block is to cover the anterior hard palate from canine to canine. To achieve this, you should inject near the incisive foramen. The key landmark to look for is the midline of the palate, just behind the maxillary central incisors. Here are some quick tips for administering anesthesia in the maxilla. First, use the mucobuccal fold as your primary landmark for infiltration and nerve blocks. Second, aspiration is key to avoiding intravascular injection. Third, inject slowly to reduce patient discomfort, and don't forget to check for numbness before proceeding with any procedure. That's it for today's video on maxillary anesthesia. In the next part, we'll focus on administering local anesthesia in the mandible, which has its own unique challenges and techniques. If you found this video helpful, don't forget to like, comment, and subscribe for more dental tips and tutorials. Thanks for watching, and I'll see you in the next video. Subscribe for more dental tutorials.